For 20 years, CRY as a charity has been preventing young sudden cardiac deaths through awareness, screening, research and supporting those affected families. When Alison first launched CRY back in 1995, we believed, based on anecdotal evidence, the number of families who had been referred into specialist services, that there was just one young sudden death a week. Over the years, we found out it was very many more. And in 2008, we published some data which showed it was at least 12 young sudden deaths every week. I think what we've done very successfully is to show the face behind the tragedy and the much wider impact when there is a young sudden death. It's not just the individual statistic, it is the first-degree blood relatives, the family, the friends, the cousins, and the much wider community. And that's been behind the success of CRY as an organisation in raising awareness. As well as raising awareness of the fact that young sudden cardiac deaths do happen, it's also raising awareness of the importance of family history, that first-degree blood relatives are referred into the NHS. It's also the importance of cardiac symptoms, what to look out for in those 20% of people who do present with symptoms prior to sudden death, but also the vast majority of sudden deaths occur with no prior symptoms. So a lot of our work is about trying to raise awareness of the importance of cardiac screening and giving people that choice. We support families often before there's any idea that CRY would ever exist as an organisation, because through expert cardiac pathology is essential. It helps families to understand the cause of death, but it also helps clinicians to understand what to look out for first-degree blood relatives. If you get the expert pathology wrong, there will be incorrect tests for the rest of the family, and there will be false reassurance. In 2008, we launched the CRY Centre of Cardiac Pathology with Mary Shepherd. And this is a quick service. Prior to this service, families would sometimes have to wait up to 2 years to understand what caused the death of their child. We now do this in less than 2 weeks. But also 80% of coroners in the UK are now referring through to this service, so we're getting very powerful data about the exact incidence of young sudden death. As I say, from CRY's perspective, this is about reducing unnecessary suffering. The young person has still died, there will be suffering, but we can reduce some of the unnecessary suffering through providing this service very early on. Once we know what caused the death, there is then the referral through to inherited clinics, specialist services. Our service at St George's is overseen by Professor Sanjay Sharma in inherited disease and sports cardiology, and families will be seen in this service quickly. They will be seen as a family unit, and all the tests will be endeavoured to be done on the day of the testing. In 1995, CRY funded the first ultrasound machine at St George's to set up a specialist service. And 20 years later, we've expanded on that. We're now funding at least 8 doctors. We have a number of international fellows who are also working with us. We have a physiologist, a nurse, and all the cardiac machinery in the youth centre to provide this fast-track service, and it's something we feel very passionately about. As well as clinical support, it's essential to give bereavement support to families after a tragedy. We have 4 families every week who will be contacting us, looking for answers, looking for support. And in the last 10 years, primarily, we've trained over 30 volunteers who have all suffered tragedies to support other family members going through the same experiences they had. And we have 20 who are currently supporting families. They've all been given accredited counselling skills to be able to do the best they can in that. And as well as individual support, there's also group support where we bring different partners, siblings, mothers, fathers together as a group to try and help them at this time. There's the My Heart Network. Michael Papadakis is the key person in the My Heart Network, helping young people with similar conditions, because it's not right for a 18-year-old to find themselves in a rehab group with 60 or 70-year-olds if they've had an ICD. So it's about having contact with other people of a similar age, with similar conditions, and trying to answer those real challenging questions about how much exercise you can do, talking off the record about the condition they have with a specialist. When Alison first got involved in this area, she was doing screening, and she set up screenings with the Lawn Tennis Association in 1993 before she even considered setting up a charity. 2 years later, she founded CRY, and we did our first school-based screening, which is really a general population screening in 1997. In 1997. In 2007, we realized that just doing an ECG screening alone led to quite a lot of false positives, and so we incorporated ultrasound into the screening. So for all those people who had a problem on the ECG or a questionnaire, we'd do an ultrasound straight away, and this transformed our program, enabled us to screen many thousands more people straight away by reducing the administrative burden of the program. In 2007, we also launched our partnership with Philips, screening the Olympic athletes up to 2012. A few years later, the RFU established a policy to screen at the highest level all the Premiership rugby players. In 2012, we had a grant just under £250,000 to set up a screening service every 2 to 4 weeks at St George's, which was open to the public. And we've seen recently the Rugby Football League have also established screening, not just at the highest level, but taken it 2 steps down. To understand why screening is so important to CRY, you need to understand the families who we are supporting. 80% of young sudden cardiac deaths occur with no prior symptoms, and that is the experience of the families who are involved with CRY. There was nothing that they could have done, no sign, which would have prevented that tragedy. And also, if we consider 80% of SADS deaths occur at home or during rest, we need to be cautious about just relying on CPR or AEDs to resuscitate people after a cardiac arrest. In 2015, CRY will test 20,000 young people. The program has expanded year on year by 20+%, and that's how we will endeavour to grow the program over the coming years. Within 3 clicks on testmyheart.org website, you can book an appointment down to about a 5-minute slot, and that's open to any person who's aged 14 to 35. 75% of the people will go through that process, and they won't have to pay anything for booking their appointment. They'll just go straight to the website. In 2005, CRY funded our first research fellowship grant with, at the time, Dr. Sanjay Sharma. I remember the moment very clearly. I was at a screening in Eton, and we were looking at how we could build the program, and we needed our own doctor to be able to expand the program. And since then, we've not looked back. It's been a model that has helped us enormously in the last 10 years, and probably just under about £5 million through CRY Families has been invested into offering the screening service, but also funding our research fellowship grant program. And that's resulted in now 21 doctors who've been trained by us. And these doctors not only work within the NHS, probably half of their time is within the specialist service, getting this specialist knowledge of young sudden death and the sports cardiology, but they're also involved in our screening program, helping to take that forward, as well as publishing research. And when they leave us, after 2 or 3 years, they will broaden our expertise of these conditions throughout the NHS and create an infrastructure within the NHS where we can, in the future, look at really offering a screening service as a routine for all young people. We've seen this graph already. For me, this is a huge achievement of CRY. When we talk about funding research, this is what more can we do than to try and bring down the costs of screening? By reducing the false positives, we are reducing the cost, we're making a national screening program feasible. And this is something I'm very proud to be part of, research which is leading to these sorts of answers. Also, once people have been identified into the system, reducing the grey area of uncertainty. So these are 2 of our big key areas of advances in research. Now, so this is taken from one of his articles. So about a year after CRY was launched, I've seen the paperwork from Alison to Sanjay, a fax at the time, giving him directions where the screening was going to be, and she referred to him as CRY's cardiologist back then. At the time, as I say, Sanjay's first screening, within those first years, there were a number of early papers, mini-symposium, fact or fiction, talking about young sudden cardiac death. Within 10 years, we had established a research fellowship grant system, and the NSF Chapter 8. Now, Sanjay played an instrumental role in the NSF Chapter 8 through the initial private members bill, which laid the groundwork for the NSF Chapter 8 thereafter. And then 10 years later now, we've got 100 publications. We're screening 20,000 people every year, and we've screened over 80,000 people so far to date. So there's a huge thank you to Sanjay, because without Sanjay's support, none of this would have been possible as far as our research and where we've gone as an organisation. What we have at St George's with all our specialist services, as well as the screening service and the support programme from CRY, and the work with Mary Shepherd, is an overlap between clinical practice and research. So through conducting specialist services, we're able to publish research, and that research is fed straight back into the way in which cardiologists and clinicians practice. That in turn has led to changes in policy, and we saw that through the NSF Chapter 8. I've said that a few times, but that was one of the biggest achievements for us as an organisation, to be part of that, where any family could get referred into an NHS specialist after there was a young sudden death or symptoms. Before that, you would see multiple sudden deaths sometimes in families because they could not get that referral. As well as that, the research is informing international guidelines, and we've seen in the UK policies and practice within screening across the board at an elite level, within football, cycling, Lawn Tennis Association, as well as many schools in the UK and universities who have taken on board screening, as well as some career paths where it's mandated. But central to everything here are the CRY families, because without the sudden death of a young person, none of this is important. It's about what we're trying to prevent, which are young sudden deaths. And so we keep CRY families central to everything we do at CRY. Thank you very much for listening.